Roughly 1 in 6 people in the U.S. have now been fully vaccinated. And today, the CDC released promising data that suggests the Moderna and Pfizer vaccines are very effective at preventing the spread of COVID infection, not just symptomatic infection. But not all the news is good. Most of the country still hasn't gotten their shots, and new COVID cases are now up 7% nationwide, which has CDC Director Rochelle Walensky concerned we may be on the verge of a fourth surge. And in a COVID briefing today, she made this emotional plea to the country.
When I first started at CDC about 2 months ago, I made a promise to you. I would tell you the truth, even if it was not the news we wanted to hear. Now is one of those times when I have to share the truth, and I have to hope and trust you will listen. I'm going to pause here. I'm going to lose the script, and I'm going to reflect on the recurring feeling I have of impending doom. We have so much to look forward to, but right now I'm scared. I know what it's like as a physician to stand in that patient room, gowned, gloved, masked, shielded, and to be the last person to touch someone else's loved one because their loved one couldn't be there. And I know what it's like to pull up to your hospital every day and see the extra morgue sitting outside. So I'm speaking today not necessarily as your CDC director, and not only as your CDC director, but as a wife, as a mother, as a daughter, to ask you to just please hold on a little while longer. I so badly want to be done. I know you all so badly want to be done. We are just almost there, but not quite yet.
It's raw honesty that rings especially true after an administration that distorted the truth relentlessly. A top-down policy we got an even closer look at last night through a CNN documentary, COVID War, Pandemic Doctors Speak Out. The film features interviews from several top officials from Trump's pandemic response team, including Task Force Coordinator Dr. Deborah Birx, who said the White House is to blame for most of the more than 540,000 total COVID deaths in the U.S.
I look at it this way. The first time we have an excuse, there were about 100,000 deaths that came from that original surge. All of the rest of them, in my mind, could have been mitigated or decreased substantially if we took the lessons we had learned from that moment. That's what bothers me every day.
I can only imagine how much it bothers the 400,000 plus families whose loved ones didn't need to die from the virus. And Trump's coronavirus testing czar, Admiral Brett Giroir, made clear in his interview for the film the administration's messaging was more than just misleading, telling CNN, quote, "When we said there were millions of tests, there were not. In short, they lied." I'm joined by Dr. Thomas Tsai. He's a surgeon and health policy researcher at Brigham and Women's Hospital and Harvard's Chan School of Public Health, also a former senior advisor to the Assistant Secretary in the Office of Health Policy in the Obama administration's Department of Health and Human Services. Dr. Tsai, it's good to see you again. Thank you for being here.
Jim, good to be with you.
Do you share Dr. Walensky's sense of urgency?
Absolutely. We are at this critical juncture in the pandemic where we can see the shore, but we've been content to just tread water. And what we really need to do is gather our resolve and swim to shore. And that means continuing with our public health guidance around masking, maintaining common sense public health measures around physical distancing, and really increasing the rate of vaccination throughout. So we are close, but we can control where we end up with this pandemic. And my worry is that we're losing steam in the resolve to really get control of this once again.
Is it because we individually are relaxing our own standards and because some states are dropping mask mandates and opening up more quickly than they should? Is that the cause for the rise?
I think it's a perfect storm of both a relaxation of vigilance, both on an individual level, in the context of policies of reopening once again. We've seen the consequences of reopening too soon. Last year around Memorial Day, we've seen the consequences of the summer last year. And when we reopen too soon, we end up just, instead of taking 2 steps forward and 1 step back, what we end up doing is take 1 step forward and 2 steps back. And we're at the same moment now in the pandemic.
I want to get to that vaccination rate you talked about a minute ago. I mentioned the good news from the CDC today was a study looking at symptomatic and asymptomatic effectiveness of the Moderna and Pfizer vaccines. 90% after 2 doses, obviously very good, but 80%, which is quite high after 1 dose, which seems to me that it feeds this notion that I know is taken control in places like, I believe, Israel and the UK, that it is far better to get 1 dose into the arms of many more people than 2 doses into the arms of fewer people. Which side do you subscribe to?
I think the truth is actually in the middle. We actually have enough vaccine supply committed to be able to vaccinate all American adults by mid to end of May. So what we should do is get as many first shots in as many arms as possible, and then use remaining vaccines to ensure that second round of vaccination. So it's not a 1 shot or 2 shots. It's 2 shots for everybody, but to get as many first shots in as we can.
Can we go from current events to a little history? I mentioned some of these doctors who were involved in Trump's, quote, response were with Sanjay Gupta, Dr. Sanjay Gupta last night. Deborah Birx, we played her comment about, or we mentioned that hundreds of thousands of people didn't have to die. We've read studies that say had the lockdown happened 2 weeks earlier, 84% of the deaths wouldn't have happened. I subscribe to John Reiner, Dr. Jonathan Reiner's Twitter post yesterday. He obviously was a White House doctor to Dick Cheney. He's now a medical professor. Dr. Birx portrays herself as an ill-fated passenger on the Titanic, when in fact she was an officer on the bridge. What's your perspective on what Dr. Birx had to say? Again, she was the leader of this task force. She was not some minion.
I think Dr. Birx was operating under very tight political constraints, and I think that's the overall message from all the physician and leaders from the administration from that CNN interview, was that there was essentially a takeover of a scientific process by political considerations, and in some ways they were all operating within the constraints of the last administration. That said, they were the leaders of the task force, the leaders of the agencies. And I think what's more important is to think about how we learn from the mistakes, and there were clearly mistakes that happened over the last year, and build robust public health systems, infrastructures that can remain independent of political decisions and maneuvering. So the science needs to be scientific and objective. The policies that flow from them will need to be informed by political considerations. But what's happened over the last year is the two have completely combined with each other, resulting in a tragic excess loss of life.
You know, but Dr. Tsai, if I may, I have no background in areas that you and Dr. Birx and others do, but I'm not quite ready to move ahead after those comments last night. Dr. Birx didn't just sit silent during the bleach episode. She went out of her way to defend the president despite the fact that she knew he was wrong. Here's a comment, for example, she made in March of last year to the Christian Broadcasting Network. Here she is.
He's been so attentive to the scientific literature and the details and the data. And I think his ability to analyze and integrate data that comes out of his long history in business has really been a real benefit during these discussions about medical issues. Because in the end, data is data, and he understands the importance of the granularity.
So, incredibly enough, she was talking about Donald Trump, despite what she said last night. Dr. Giroir, who was Admiral Giroir, who's not an admiral, last night, he was in charge of testing, mentions the fact that they lied. They said there was testing available for everybody. There was not. Dr. Redfield talked about the Secretary of Health and Human Services, Secretary Azar, trying to get him to cook the books on mortality and morbidity rates. Is there no accountability that's appropriate for these people? What happened to do no harm? It seems to me they did harm on steroids.
I think, Jim, that we definitely do need a full accounting of what's happened over the last year. There needs to be transparency about the processes that informed these decisions that are clearly politically motivated. And the individuals and the administration needs to be accountable for the harm that was caused over the last year by Dr. Birx's admission in excess of 400,000 deaths. However, though, I think what's more important, though, is there's always a chance in our politics and our policies of individuals taking over the structures that guide our public health decision making. What we need to do is create robust systems where we can have independent scientific agencies that provide the information for policies to be made. There are examples of this in our federal government. The Federal Reserve is led by nonpartisan leaders that are more immune from the political winds from either the White House or for Congress. And I think what we do need is a nonpartisan commission and after action analysis of what went wrong so we can be more prepared for the next pandemic. And that really means preserving the integrity of the scientific process, which just did not happen over this last year.
Dr. Fauci is also a perfect example of that independence. Dr. Tsai, as always, I really appreciate your perspective. Thank you.
Great. Thank you, Jim.